Hi everyone. So my name is Bonnie, and I'm a recently graduated optometrist based in South Australia. Just like to thank you all for coming on tonight and listening to my presentation. So Glaucoma Australia have really kindly asked me to present about the topic of how to be your own advocate, a patient's responsibility in their own eye health. The content of today's presentation will take more of a focus on glaucoma, but I think you'll find it can definitely be applied to other eye health conditions as well. So firstly, I'd like to address what it actually means to be an advocate for your own eye health. So health advocates take control of their own healthcare experiences, and it allows you to make decisions as a team. And so it involves having an active role in the patient-doctor relationship rather than simply a passive role. And it really empowers the patient to speak up with their questions, needs, concerns, and preferences. And so while eye care professionals are the experts on the eyes and their eye health, patients are the experts on their bodies and their lives. And that's why it's so important to be able to advocate for yourself in healthcare. And so secondly, I'll address why is it important to be your own advocate. So while eye health professionals have a very important role in looking after a patient's eye health, patients have an equally important responsibility as well. And I think glaucoma is an excellent example of that because treatment for glaucoma is a real battle that's fought between the eye care professional and the patient. So it's really important that full participation of the patient is required. And no matter what the eye care professional says at that point in time, it is the patient that is responsible for the day-to-day treatment of glaucoma as well. And patients who are involved in their own eye health care are actually more likely to have a good experience, have information about their own eye health, and have realistic expectations. They're also able to reach shared decisions about diagnoses and treatments that are right for them, and also to manage their care, adhere to treatment, and just overall have a better health outcome. And which really comes down to having great communication as well, and having what we call a patient-centered approach. And that just really encourages that open two-way communication as well. So that's why it's so important. And now I'll address like how we can actually better advocate for our own eye health. So I'll go through each of these points more in detail as well. So firstly, it's important to provide accurate information and prepare for the appointments as well. So this includes discussing any previous or current issues with your eye health. So even things that might sort of feel a bit irrelevant, like a previous eye injury, has actually been shown, can cause a type of glaucoma, good angle recession glaucoma. And that can even happen after 50 years after the injury. So it's just really important to address all aspects of your previous eye health. So even things that might just seem a bit irrelevant because they happened so long ago. And it's also really important to list all of your medications, allergies, and medical history as well, because a number of health conditions like diabetes, high blood pressure, heart problems, thyroid issues, and autoimmune conditions can all have effects on the eyes. And they actually influence the testing that we do as well. So, for example, with diabetics, we'll see the patients every year for a dilated eye exam as well. And a number of those health conditions have actually been shown to be risk factors for glaucoma as well. So like diabetes, blood pressure, migraines, and obstructive sleep apnea as well. And having prolonged steroid use can also increase your risk for glaucoma. So it's important to know if you've been on steroids, whether that be oral, topical, or inhaled steroids as well. And there's also several medications that can have ocular adverse effects, or just side effects on the eyes. Plaquenil is a very big one that does influence the testing that we do as well. So for Plaquenil, we'll do like a central visual field testing as well as an OCT examination of the macula, because it can have effects on the macula and cause maculopathy. And it's also really important so we know if there's any potential side effects with your glaucoma medications as well. And probably we're all quite familiar with this one, so it's really important to discuss family history because, as probably most of us know, having a strong family history of glaucoma does significantly increase your risk for glaucoma. And it's also important, I guess the patient has a responsibility to let the eye care professional know if you are having issues. So any like sudden vision loss, flashes and floaters, red eyes, painful eyes, double vision, they're all warning signs of an eye emergency as well. And secondly, is asking questions and gaining understanding. So the more the patients know about their eye health, the more likely they are to stick to a long-term glaucoma management plan. And glaucoma is a very complicated eye condition. Even at uni, we spent a long time studying glaucoma because there's so many different types and management and causes as well. So, but it's really important to have a basic understanding of what glaucoma is and its treatment. And that applies for any other eye health condition as well, because the more you understand, the better equipped you are. Um, and it's also good to note to bring an interpreter if you English is a second language, or you can always bring a friend or a family member to help. So it just helps establish really good communication, and then the eye care professional can actually allow extra time if English is a second language because it can take a bit longer. And it's also really important to have a list of questions to ask. So um, there's a really good guide from Glaucoma Australia on their website, but it's important, again, to ask whether you actually have glaucoma and what type, and what effect this will have on your vision, how to take the drops correctly, what treatment options are available, and how often you'll need to be followed up. Um, and in saying that, there's lots of free education and support with Glaucoma Australia through their patient support calls and fact sheets as well, because it can be hard sometimes when there's time constraints to answer all the questions, or if you forget to ask a question, it's always good to have that backup option as well. And so that was the fact sheet I was referencing to from Glaucoma Australia. So I won't go into all of this, but it's just a really good little checklist that you can always bring into the appointments as well. And number 3 is to follow the treatment plan to the best of your ability. Again, specifically applies to glaucoma because it is a lifelong commitment. And there are little things you can do to help remember to take the eye drops every day. There's certain apps available as well as setting an alarm can be very helpful. And it's also important to let your ophthalmologist know straight away if you're having any issues with your treatment plan. So I wouldn't just simply wait until the next appointment. So let them know as soon as you can. And this may include any side effects that you've had to your treatment as well, because they can always consider other treatment options as well, like laser trabeculoplasty can, in some cases, be considered first line treatment as well. And number 4 is to attend regular follow-up appointments. So this is ultimately the patient's responsibility to attend the eye appointments, as the eye care professional has suggested. And I think it's also really important to note that many other eye conditions can occur simultaneously with glaucoma. So it's still important to really have your comprehensive eye exams with your optometrist or ophthalmologist to watch out for things like cataracts, macular degeneration, diabetic retinopathy if you're a diabetic as well. So, and number 5 is discussing any financial and social issues or barriers as well. The cost of glaucoma management can definitely add up when you consider all the ongoing appointments and the treatments as well. So I think it's really important to mention if you are having any financial concerns. There is always the possibility for like a reduced pension rate or to have some of the visual field tests bulk billed as well. And it's also good to there's also a possibility of a share care glaucoma management plan. And when I looked up the actual definition of that, according to RAND's Co, which is the ophthalmology body, they said it's the delegation to optometrists of some part of the regular monitoring of patients with stable glaucoma or in whom glaucoma is likely to develop. So it doesn't include if an optometrist refers to an ophthalmologist or if an optometrist is communicating a finding that may enhance the patient care. For example, just saying what the pressures are or what the prescription is or their visual acuities are. So me personally, I haven't participated in a share care glaucoma management plan yet, but I am aware of quite a few of my colleagues who have, and I think it can be a really great option if it's within the scope of the optometrist and they've got the equipment available as well. But yeah, definitely worth speaking to your ophthalmologist and seeing if something like that could be set up, because that could really reduce some of the financial costs as well as things like traveling and so on. And it's also good to consider the private or the public system when it comes to your ophthalmological care. So the public system, Medicare will cover all the visits, but it's important to be aware that there's a considerable wait time involved. So it's important to still see your optometrist in the meantime for your regular checkups, as well as you, unfortunately, you don't get a choice of doctor as well. So that's another thing to consider as well. And another point I really wanted to make was to build your own eye health care support team. So ophthalmologists have a really important role in diagnosing and managing your glaucoma, whether that be drops, laser, or surgery in some cases. But it is quite a multidisciplinary management plan. So optometrists can also really help in monitoring your glaucoma in between your visits, as well as prescribing glasses and just checking your overall eye health for things like cataract and macular degeneration as well. And your doctor also plays a really important role because they can always prescribe eye drops if you run out of some of the eye drops, and just also advice about eye effects as well, adverse effects. And pharmacists can also be a good point of call to answer any questions as well about the side effects and dry eye options as well. And it's also it's okay to want a second opinion because I think any eye care professional would realize that it's most important that the patient feels confident and comfortable in their glaucoma management. So you can always request a second opinion and suggest to be referred to another ophthalmologist, or you can always get your optometrist to refer you to another ophthalmologist as well. But it's just good to include sort of all the previous records from the other ophthalmologists, so kind of know what you've been prescribed in the past and as well. And number 6, it's also, I mean, this whole presentation's been advocating for ourselves, but it's also really good to advocate for others. And I'd encourage everyone to share their knowledge and experiences in support groups. And the Glaucoma Australia support group is a really great example of that, because the more we all know about glaucoma, the better, I guess, equipped we are, and the more we can sort of help to prevent blindness and vision impairment as well. So that wraps up my talk. So thank you so much for listening. And I'm happy to answer questions. Just having a look at the chat. So I'm just seeing number 1 is, what are the benefits of having both your optometrist and ophthalmologist involved in your eye care plan for glaucoma? So it is really good to have both on board. Because your optometrist, as I said, can see you in between your ophthalmology visits, and they can also be a really great way to answer any questions that you have, as well as things like checking your pressures in between appointments and checking your optic nerves as well. And Yeah, as I said, it is quite a multidisciplinary thing. So I think having both sides on board is really important. And your optometrist can always be a good point of first contact. Like if you're having any issues with your eyes, and then we can always refer you to your ophthalmologist if there's the need be as well. So number two is, should I be reporting new medications to my eye care professionals and why? Yeah, very important to report any new medications. As I was saying in the presentation, like there's a number of medications that can cause effects on the eyes, but it's also important to sort of get sort of if you're on, say, a lot of high blood pressure medications or cholesterol medications, it sort of helps us have when we have a look at the backs of the eye, sometimes you can see signs of high blood pressure or cholesterol issues as well. So it just helps us have a good idea of having an idea of your general health can help us with assessing your eye health as well. So yeah, always really good to mention any new medications. Number three, my optometrists and ophthalmologists are not too keen on discussing alternate therapies beneficial to glaucoma. Should I try them anyway, and should I still let them know I am trialing them? I think um, as an eye care professional, we're always taught to do that, like evidence-based treatments. So for glaucoma, that is eye drops and laser and surgery as well. But insane. So that's always what we would recommend. But as it's good to mention that if you are taking an alternate therapy, as long as it's not causing harm, that's the main thing, or if it's interacting with any of your current medications. But certainly there's things, I know there's a lot of talk about nicotinamide at the moment that's being studied, but I don't think things have been quite finalized yet, conclusive yet. But I mean, there's things like having a healthy diet and exercise, and I mean that's always things that should be promoted anyway. So yeah, I think to summarize, yeah, I would let your eye care professional know if you are trying an alternate therapy, and yeah, the main thing is if it's not causing any harm, yeah, and it's not replacing your current treatment that was recommended by your ophthalmologist. Number four is, how can I stay up to date with potential glaucoma clinical trials I can participate in? I think I'm pretty, as far as I'm aware, I think usually your ophthalmologists, they would participate in quite a few clinical trials. I think they would normally communicate if there were any clinical trials that you were eligible for. But I know that the Centre for Eye Health Research Australia, or SERA, they do quite a lot of clinical trials, and they post them quite regularly on their website. But yeah, that's as much as I know. There might be some other avenues that you can stay up to date with. But yeah, I hope that helps. And number five is, should my GP be aware of any changes with my eye care plan and why? Yeah, I think your GP is a really good point of call, and they are sort of responsible for your overall health in general. So I think they should definitely be aware of any changes to your eye care plan. I think specifically with diabetes, that's very important because diabetics need to be seen every year and by optometrists. But and that can, if there's any complications that we can find, the GP should definitely be aware because that would maybe influence their management as well. But I think in general, like your GP should be made aware, and they're always a point of call for referrals as well, and also for all your medications as well. Yeah. Six is, I feel like there is never enough time to ask questions during my eye appointments. Should I be asking the questions anyway? I feel like it can be annoying to my eye care professional. Yeah, I mean, obviously in an ideal world, we would have like hours to answer all the questions, but I definitely encourage all my patients, everyone to ask questions as much as possible, because I think we all realize that the more patients are aware, the better sort of health outcomes they'll get. So, as I said, like having a list of questions is really helpful. But I mean, if you always run out of time, there's always support. Um, there's always the Glaucoma Australia support calls as well, that you can ask extra questions at. But yeah, definitely ask the questions. That's very important. um, 7 is, what advice do you have for patients located in regional towns? Eye care professionals come here every few weeks or even months. What is the best approach in an emergency? Um, Yeah, I mean, I suppose it depends how regional, I guess. Uh, yeah, I mean, I guess if there was a true emergency, and there was no optometrist or ophthalmologist readily available, it would be your GP or the hospital as well. But that is quite a tricky situation, and then they could always try and get in contact with an ophthalmologist. But yeah, luckily, sort of, yeah, I guess it depends how regional, I suppose. Um, I mean, I think most optometrists have pretty. There's quite a lot of work in rural areas to try and sort of help with that. But yeah, I suppose, yeah, seeing your GP or the hospital, or yeah, would be the first point of call if there was no other eye care professionals available. Um, there's a question from Michael. I hadn't realized there were several types of glaucoma. Um, can you elaborate, please? Yeah, there's quite a few. I mean, there's two main types, in that there's the open angle glaucoma and closed angle glaucoma. But there's several sort of different types for each. I probably won't go into every single type, but there's like your primary and secondary causes of glaucoma. So there's things like pseudo exfoliation and pigmentary dispersion glaucoma, that as well as there's like inflammatory glaucoma as well. So that's like linked to like uveitis, that can cause a glaucoma, as well as um, there's, yeah, quite a few other types as well. Um, but yeah, hope that answers that question. Okay. And steroid-induced glaucoma is another big one as well. And also like any traumatic glaucoma as well. So yeah, there's quite a few. I mean, there's sort of the two main types, but there's quite a few in each category. Yeah. Question from Lily. Is it true that if one has high blood pressure, can end up with glaucoma? Yeah, there's been some suggestion that with glaucoma, that it can be linked with blood pressure, because the theory is, with because the optic nerve has a blood supply, and so any sort of fluctuations or changes in the blood supply could potentially cause damage to the optic nerve, and which can cause glaucoma. So yeah, there has been thought to be a link. Yeah, so it's more the changes in the blood pressure that can cause damage to the optic nerve. Yeah. Question from Kathy. Is there any telltale signs that your pressures have gone up before you're even told they have? The tricky thing with eye pressures is that normally there's no symptoms, unless they're very, very high. So, which would be above like 40, um, which you would know because that's essentially acute angle closure glaucoma. So which is causes like a really red eye and blurry vision and headaches and nausea. But other other things like just normal fluctuations in your pressures, or if they're getting into like the mid 20s or high 20s, there's usually no symptoms of that, and so that's why it's so important to get your eyes checked regularly, because there's no real symptoms unless they're very high. Yeah. Question from Heather. So, thanks, Heather. Are there any end user devices available to purchase to allow one to measure the pressure of their own eyes? This would allow monitoring in between visits to the eye specialist. Yeah, there are. It's good. Some options to measure your pressures at home. It's good the eye care home too. That's which is a really good way to, yeah, be able to do that. Check your pressures at home, and how they vary during the day. But it is available to purchase from the Glaucoma Australia website. So I would, yeah, encourage you to ask, to call their hotline, and you can ask questions about it as well. So yeah, I hope that answers that question. Yeah, thanks again, everyone, for tuning in tonight, and I hope that was useful information. Thank you.